18 people have died from suspected overdoses in Knox County this month. The district attorney general says that brings the total number this year to 283. 293 people died in all of last year. Drug-related deaths accounted for the third largest number of deaths in Knox County in all of 2017.
10 News reporter Mark Salinger adds some context to those staggering numbers.
Robin and John, let's take a look at the overdose epidemic by the numbers to help us understand the problem. The Knox County Health Department says drug-related deaths accounted for the third largest number of deaths in Knox County in 2017, falling well behind heart disease and cancer. Across the country, 70,237 people died from drug overdoses in 2017. That's according to the Center for Disease Control. That would make drug overdoses the 8th leading cause of death in America if they were considered their own category. Accidental drug overdoses were the leading cause of death in the United States for people under 50. Here's how drug overdoses stack up against other leading causes of death in our country. More than 51,000 people died from the flu and pneumonia last year. Around 50,000 people died from kidney disease, and around 45,000 from suicides. Those are all in the top 10 leading causes of death for Americans. Back here in East Tennessee, the medical examiners in Knox County and Anderson County saw a sharp rise in drug-related cases. In 2010, 12% of their cases were drug-related. That's 101 of 836. By 2017, it was up to 30%, 362 of 1,182. The problem has gotten so bad that the U.S. life expectancy has actually decreased over the past couple of years. The CDC says that's largely driven by deaths from drug overdoses and suicides. Robin and John, we'll send it back to you.
Mark, thank you. A new study out of